Assalamu alaikum. Ultrascan diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is implants in all the edentulous spaces. On the panoramic view, you can see that we have periodontal disease and we have some few recent extractions with bony defects in the edentulous spaces. We have placed implants, but we will take you through the measurements of those ridges first so that you have a good idea. Now, this is the top right quadrant. This is where the first molar is. This is where you can see we've got a ridge width of 11 millimeters and we've got a ridge height of 4 millimeters. Implant placement can only be done if sinus lifting is done in the upper right quadrant. But something to be highlighted is that there is severe sinusitis that we can see. So a sinus lift procedure should be done very carefully, especially with this sinusitis. Similar situation in the upper right second molar region. Again, we have sinusitis. We've got approximately 10 millimeters of ridge width with 2.8 millimeters of ridge height, and again we can see sinusitis here as well. Moving to the lower right segment, the lower right segment can house a second molar very comfortably. Here you can see right there. So we've got a measurements of approximately 8.6 millimeters of ridge width with approximately 12 millimeters of ridge height. Moving to the lower anterior region, we've got good quality bone. This is D1 level bone. We've got approximately 4.7 millimeters of width with approximately 12 millimeters of height in the lower right central incisor. And the lower left central incisor also has good bone. We've got 6 millimeters of width with approximately 13 millimeters of height. The lower left second premolar, we've got again excellent ridge. 7.7 millimeters of ridge width with approximately 13 millimeters of height. There is a bony defect below the cortical area, so this needs to be evaluated, but you have 14 millimeters of distance between the crest of the ridge to the mental foramen or mental canal or the inferior alveolar nerve. By the end of it, so the upper left quadrant is going to be our main focus. Next, the upper left first molar region, we've got slight bone here as you can see, but to give you a better idea, the ridge width is going to be 6.8 with the ridge height being just 4.6 millimeters. Sinus lifting will be required here as well, but as you can see, the sinusitis is not as severe as it is on the right hand side. The ridge gets a little thicker and a little better in height at between the 7 and the 8 region. This is 7.3 in width with 4 millimeters of height. So again, the implant can be placed with sinus lifting procedure. Lastly, we have the lower left second molar region. We've got 10 millimeters of width with approximately 10 millimeters of ridge height. The bone quality here is D3 because we don't see any thick cortical plate, and we have placed these virtual implants for our doctor. There we go. We've placed all the implants in the most ideal locations. The number of implants can be increased or decreased based on the doctor's specification. The upper right and the upper left region will definitely need sinus lifting to house implants. There is no bone augmentation that needs to be done in the lower segment. This is the 3D rendering. An implant planning report would also be shared with the doctor. We've placed new biotech implants, so it's easier for the doctor to plan accordingly. If there are any further questions, please feel free to reach to our team. Thank you very much.